Hello, Facebook world. My name is Kara. I'm one of the co-owners of Des Moines Mom. And today we are speaking with Kelly Brown Gross, and she is with the Iowa Clinic, and she is a physical therapist. We are going to be chatting today about pelvic floor physical therapy and some of the things that go along with it. But Kelly, what location are you at?
I'm actually at two locations. I'm in our Ankeny Clinic, which is on the southwest corner of Ankeny, and also in our West Des Moines Clinic.
Okay.
So two locations.
Okay, very good. So if you are interested in connecting with Kelly and getting on her schedule to chat with your any physical therapy issues that you have, that's where you can find her. Like I said, today we are chatting about pelvic floor and physical therapy related to it. So Kelly, can you tell me just a little bit more as far as what the pelvic floor is and how it functions in our bodies?
Okay. Yeah. So the pelvic floor muscles are a group of muscles that are on the floor of our pelvis. So basically exactly where they sound like they should be. And their role and function in our body is multifaceted. They are support muscles for our internal organs. So that's one of the little known things about these muscles. So they actually support, for women, our uterus and ovaries, our bladders, and our rectum. Okay. They also are stabilizer muscles for our pelvis. Pretty important group of stabilizer muscles. And probably the most well-known is they control urinary and fecal continence. So they're our bowel and bladder control muscles. And then they also do function sexually. Sexual appreciation is kind of how I term it. So basically any problems with those muscles, you can experience problems in any of those areas.
Okay. That is a lot of information I did not know. What are some just common misconceptions about the pelvic floor?
So a lot of times I see patients that they come in and they think that their muscles are weak. And a lot of times that's actually not the case. There can be multiple things going on. They can definitely have some weakness of those muscles, especially postpartum recovery from a vaginal delivery. If there's any, forceps or vacuum extraction during delivery, those assisted deliveries, or tearing or episiotomies, they can definitely have some trauma associated with that and have some weakness. But also there can be some uncoordination of those muscles, and there can actually be more overactivity or an over recruitment pattern of those muscles. So they can actually be too tense and tight that can be causing some of those problems. Yeah, not just weakness of those muscles.
Okay.
And then another misconception or myth is that women need to be holding those muscles tense all the time. So doing a Kegel, just holding their tummies in, holding their core in, holding those muscles tense and tight. Well, that can actually lead to some of that over recruitment pattern that I was talking about. So those muscles are meant to just kind of work in our bodies under the radar without us having to think about them. And when we do think about them too much or too often, you can actually feed into some dysfunction type patterns. And so that's one of the things I discuss with my patients is how to find balance in those muscles and not overly recruit them, but recruit them enough so that they do their job and work well for them.
Okay. You talk about dysfunction and, problems that you see in your patients. What are some things that you see patients coming in for? And what are some problems or things that you see?
So I see a lot of urinary incontinence. So urinary incontinence is any leakage of urine that's not intended. So basically, if you intend to leak urine, you're going to be sitting on a toilet or actively trying to empty your bladder. Any other leakage of urine is considered incontinence. So we have multiple types of incontinence that go on. One of the main ones is called stress incontinence. That is leakage of urine if when we cough, when we sneeze, when we do a jumping jack, when we jump on the trampoline, any type of impact type activities, but basically any type of intra-abdominal pressure event that causes the urine to leak is called stress incontinence. Another type of incontinence is called urge incontinence. And that's kind of like it sounds like it should be. It's with an urge to go to the bathroom or on the way to the toilet, where, women just tell me, oh, I just wait too long and I leak on the way to the toilet, or before I can get my pants pulled down and sitting on the toilet, I have a little bit of leakage. So those are two big things that I see. But also pelvic pain is a big part of my practice as well. So pain with intercourse, and this can be, before or after baby. It can be women that have never had babies. So it can be just kind of a problem, muscle dysfunction or uncoordination or over recruitment pattern that leads to pain. But also just having the bladder issue of more frequency or urgency related to the bladder. General term is called overactive bladder, but just having to go to the bathroom too often or feel like they don't have control. They have to just keep going to the bathroom and emptying their bladder more often than they should. So those are some common issues that I see in my clinic.
Okay. With these issues and common problems and things, do you feel like they are, related to age, or like what you talked about? Is this kind of a result of having babies and being postpartum?
I mean, there are definitely some common things that happen postpartum. Stress incontinence is the big one that, after babies, and it's those muscles, the pelvic floor muscles, but it's also how they connect with the rest of the system. And so the system, or the team, as I call it, is actually our inner core. So it's a group of muscles made up of our diaphragm, which is our breathing muscle, and then our deep abdominal, called the transverse abdominis, that work together with our pelvic floor muscles that work together to manage those pressures, those intra-abdominal pressures. So that's a common theme that I see in my pregnant and postpartum population, is because that's, rib cage to pelvis, that's where most of the changes occur. So everything gets stretched out, the rib cage gets pushed up, the abdomen gets pushed out, and then the pelvic floor muscles, if there's vaginal delivery, those muscles get stretched out to the side as well. So that's a very common diagnosis in postpartum, for sure.
Okay. So, with these diagnoses and those issues that you see, what are things that you help women with, and what are things that we can do to, maintain or restore, good pelvic floor health?
So right away during the first session of physical therapy, I usually like to assess the pelvic floor muscles. And because those are the muscles that we can't see, a lot of us actually don't know quite where they are, what they do. And so assessing those muscles, getting the woman to be able to kind of become aware, identify those muscles and how they work. So that's typically, and so I am trained in internal exams. I'm trained in external, feeling or palpation to assess those muscles if the woman's not quite comfortable with the internal exam. So that's usually first and foremost. So how do you actually do a Kegel exercise, and then how those muscles work with the bigger system. So I pull in their breathing, their deep abdominal, kind of all that, make those connections there. And then after that, depending on what we find, there could be some over recruitment pattern. Then we actually kind of work on relaxing those muscles. And actually that, I know that sounds counterintuitive, but sometimes that's what the body needs, is just to find that balance for, not overly tense and tight, but kind of more focused on the relax. So, and then we talk about posture, because that alignment plays a role in how everything functions. And then that's the foundation. And then basically we layer movement on top of that inner core, that foundation. And that's the restoring of function and return to fitness postpartum that a lot of women are after.
Okay. That's very interesting and kind of cool to think about. How many, if somebody comes to you for, pelvic floor issues and, physical therapy, is this something that, you cover in a few sessions, or is this, what can somebody expect as far as how long, this might take to restore?
Yeah, so it depends is the best way to answer that. but we actually did implement a program a year or two ago. It's called the One and Done program. And this is specifically for postpartum moms that basically want to come in for like one session and get an evaluation and check pelvic floor muscles, check breathing, check posture, check for a diastasis recti, that separation of the abdominal muscles that's kind of you hear about all the time. So just, and then make sure they're on the right path or track to restore, you know, their core and return to fitness or whatever they want to be doing. So that one and done is one and done, right? That's kind of what we do. But this is typically for the new mom that really has had a pretty typical delivery, didn't really have any complications, nothing big is going on, like nothing too worrisome, right? Just kind of like, I'm feeling good. I just want to make sure I'm doing the right thing for my body, you know, so that in 20 years, I don't have issues. So that's the one and done. Like I said, that's for your typical postpartum mom that's not really having any issues, but wants to get an exam, an assessment, and make sure they're on the right track. So they are preventing, more preventative for long-term things. And then there's, you know, the women that had, you know, maybe a third or fourth degree tear that have more trauma, or that had a forceps or vacuum or had a C-section delivery, and they're just having more scar tissue or more specific things going on, like pain, you know, still having, you know, any pelvic girdle pain with intercourse, that are having incontinence, leakage of urine, are having bowel issues going on. So that's another common one that I see, either constipation or fecal incontinence, especially with a third or fourth degree tear, because that affects the bowel control muscle, the external anal sphincter. So those women will need to be seen more than one visit. So we're talking probably 2 to 6 visits is kind of my average, I would say, depending on that particular woman's needs and wants. Sometimes they only want 1 or 2 visits, and they're like, yeah, I got this. But other times it's a little bit more to kind of get them to the point where they feel confident and independent that they can continue on their own with things.
Okay, no, that is all super important and super good to know. I feel like, you know, we've covered a lot of really good information as far as the pelvic floor and pelvic floor physical therapy and when to, you know, look into getting help. But that leads me to my last question. So somebody, you know, has decided, okay, like, you know, I want to make an appointment and to come in. Can they make appointments directly, you know, through the Iowa Clinic website, or do they need to be referred first?
So in Iowa, if you have Blue Cross Blue Shield as your insurance, and if you want to go through insurance, Blue Cross Blue Shield does allow for direct access to a physical therapist, so you don't actually need a physician referral. All the other ones typically would need a physician referral, but usually you can get that at your 6-week postpartum visit, or you can, you know, if you have a good relationship, you can usually just call in to your doctor and like, hey, I'm having this and this going on, or I want to do the One and Done program. Can you give me a referral to physical therapy? And it's usually pretty easy. But then after that, they can set up the appointment directly on our schedule. The OB-GYNs, gynecologists can at the Iowa Clinic. They have access to our scheduling, but also you can schedule online, or you can call in.
Okay. Well, that sounds good. That's good to know how to get on your schedule to get in. So thank you so much today for your time, Kelly. This is all really good information that I don't think it's talked about enough. And I'm sure that many women are like, oh, I should probably talk to somebody about that. And this is a real issue, but an issue that I can make better. So why shouldn't I make it better? Yeah. Very good.
Yeah, for some reason it still is kind of taboo in our society, but it's very common to have issues especially after childbirth and pregnancy. but those things I talked about, like the incontinence part, the pelvic pain, those are not normal things after delivery. Like I said, common, but not normal. So they're definitely things that you can talk to your doctor about and get a referral for therapy or contact a physical therapist for.
Yeah, awesome. Well, thank you so much for your time today, Kelly. And we look forward to having more women talk about their pelvic or their pelvic floor and getting things back to normal.
Right. Thank you so much. Appreciate it.
Thank you.